So in the general medicines, you are supposed to write about when they can ask you about any kind of a short note on lung abscesses. So they ask you about the treatment modalities and what is lung abscess, what are the clinical features, what are associated to it. So in this video, we'll be discussing upon the important, what are the clinical features of it, and how are you going to progress with your answers in exams when it comes to lung abscess. So beginning with, in this video we'll be discussing about as to what is the lung abscess and how it is treated. So in this video we'll be mainly focusing on this. So starting with, when we look at the lung abscess, so what is this lung abscess? So lung abscess is defined as a localized pyogenic infection. So viewers, do remember this when we talk of the lung abscess. So it is a localized pyogenic infection, means there is some sort of a bacteria, there is some sort of bacteria what are responsible for this. So there is pus forming bacteria what is going to affect the lungs, and in this what we are going to have, that it is a pyogenic infection. So means there is accumulation of pus forming bacteria into the lung parenchyma, and actually there is going to occur the liquefactive necrosis of the lung. So in this situation, what do we find is that the lungs are going, since the lung is a moist organ, and the terminal bronchioles are going to end up into small tiny alveoli which are filled with air. So since it is a pyogenic infection, so within the pleura of the lung, actually this infection is going to cause certain kind of a necrosis, and there is accumulation of abscess or pus. So since the pus is being deposited, it is a pyogenic infection and it is localized to a particular site. It can happen in a particular site. And apart from this, it is characterized by suppuration, means the pus is slowly and gradually, thus there is a small localization of a pus in certain area of the lung, and there is destruction of the lung parenchyma. Since the liquefactive necrosis is there, so there is destruction of the lung parenchyma, and ultimately which is going to cause cavitation, and with cavitation that is going to form an abscess. So viewers, do remember that is this lung abscess, it is actually a microbial infection, and it is characterized by the liquefactive necrosis of the lung parenchyma, and there is accumulation with the formation of cavitation. There is accumulation of the pyogenic material, and this pyogenic material is going to cause cavitation, and ultimately it will form an abscess. So it can be of two types, if depending upon the onset of the period. So for how long this abscess is being there, so depending upon the onset, it has been found that this lung abscess can be divided into two types. If it is an acute case, that is the duration, based on the time duration, it can be either of 4 weeks, or if it is a chronic case, it can be greater than 4 weeks. So viewers, do remember, based on the time duration, this lung abscess can be divided into two. One is the acute phase, where it is a period of infection is less than 4 weeks, and if it is a chronic case, the period of infection is greater than 4 weeks. Now, one thing more I would like to emphasize, that slowly this lung infection, if it is going to take place, what is the etiology of it? So when we look at the etiology of this lung abscess, what do we find is that in the etiology, actually this aspiration, particularly the aspiration of the oropharyngeal secretions. So during any kind of a diseased condition, if the patient is going to inhale the aspirate, particularly not inhale, the word is aspirate. If the patient is going to aspirate the oropharyngeal secretions, what are related to in any kind of an unconscious state, or during any kind of an intubation, or whenever the patient is unconscious, during unconsciousness, whatever the oral secretion is there, and if the aspiration of the infected oropharyngeal secretion, it enters into the lung parenchyma, so it is responsible for causing the lung abscess. And ultimately what do we find is that So basically, in cases of dental infections, in cases of periodontal infections, and in cases of oropharyngeal secretions, when they get aspirated into the lung, this becomes the causative factor, and this becomes the etiology. So actually, this is the etiology of lung abscess. Now, when we look at the clinical features, so the clinical features of lung abscess can basically include, earlier in the olden times, firstly, it was described by Hippocrates. And at that time, in earlier times, when there were no medications for it, it was seen that one third of the patients used to die because of lung abscess. And since there were no antibiotic regimen at those times, so one third of the patient used to die previously in olden times, in the pre-antibiotic era, the patients used to die just because of this kind of an infection. And the later one third of the patients, the next one third of the patient would progress into a chronic infection. That is, the lung parenchyma is going to be affected chronically, and it will progress to a chronic abscess. So in olden times, in the pre-antibiotic era, this was untreatable, and at that time only the surgical resection was the only option available at in the previous times. But now, when we look at moving on to the clinical features of lung abscess, so what do we find is that in the clinical features, the most common symptoms what are seen, it is cough with large amount of mucopurulent sputum. So whatever the patient is having, the sputum what is there, what the patient is having, the discharge on coughing, it is associated with certain kind of a pus discharge along with the mucus. When the patient is coughing, so patient is going to the patient is going to cough with a kind of a secretion. What is there is, it is having a mucus component. Apart from this, there is a purulent exudate is also present, and this mucopurulent sputum is there when the patient is coughing. Apart from this, the general clinical symptoms can be in the form of fever, malaise, and signs of toxemia. So when we talk of signs of toxemia, since it is a bacterial infection, so particularly the streptococcus, the staphylococcus, and the klebsiella. So these are the causative organisms. And particularly when we talk of children, so staphylococcus is the main causative organisms which are responsible for causing lung abscesses in children. So particularly in children, what do we find is these microorganisms, these anaerobic microorganisms, when they are going to flourish, so just because of their excessive amount in the blood, so actually the toxins are getting increased, so there is more production of toxins, and the signs of toxemia such as fever, breathlessness, shortness of breath, malaise, all such symptoms, they appear in such patients. Apart from this, the patient may also complain of chest pain. So this is another very important clinical feature. The patient may complain of chest pain when the pleura is involved. So whenever the lining of the pleura, which is surrounding the lungs, so whenever the pleural cavity is getting involved, so actually the chest pain is there. And the purulent symptoms, which is actually the pleura, if the pleural fluid is getting affected, so the lung, you all might be very well aware that the lungs are enclosed in a pleural sac or a pleural cavity. So this pleura, if it is getting affected, so actually the purulent symptoms, which include foul smelling due to anaerobic microorganisms. So there is purulent discharge, and this purulent symptoms, actually when the patient is going to cough, just because of the anaerobic microorganisms, there is foul smell seen. And apart from this, the patient may cough blood as well, so there can be hemoptysis as well. And when we move on, that what do we find is that clubbing of fingers is present. So you must have seen that clubbing is always associated to the bulbous enlargement of the terminal phalanges. So whenever there is terminal, the bulbous enlargement of the terminal phalanges is there, so that is clubbing. And actually in clubbing, what is going to happen is that the connective tissue, what is underlying the nail bed, the skin of the nail bed, so that is going to swell up, that is going to enlarge. There is proliferation and swelling of the connective tissue, which is going to cause the terminal distal phalange, the tips of the phalanges to swell up. So the terminal phalanges become swollen up, and this condition in medical terminology, it is called as clubbing. as the process becomes chronic, slowly and gradually, if the lung abscess is not treated, so as the process becomes chronic, the patient starts losing weight and appetite. So the actually once the infection is proceeding, so the patient will be having the symptoms of fever, malaise, so coughing of blood. Apart from this, there will be mucopurulent discharge during coughing. So such symptoms, if purulent symptoms are these, is going to persist, and if it is untreated, so ultimately this is going to cause the patient will slowly and gradually start losing weight. Apart from this, and there is reduction in the patient's appetite as well. Now moving on to this, when there are signs of consolidation of lungs. So actually, what do you understand by the term consolidation of lungs? So actually, what do we see is that in the lungs, the terminal bronchioles, they are going to end up into tiny sac-like structures, what are called as alveoli, which are air-filled. So when these alveoli, these are air-filled spaces, whenever these air-filled spaces are having other materials, such as there comes blood, there comes water, there comes any kind of a purulent discharge, there is pus. When these tiny alveoli, the terminal alveoli, when they are getting in the normal routine, there is air present in the alveoli. But when this air, due to some reason, there this air is not present and it is invaded by a certain kind of a pus, fluid or liquid, and the of the lung, when the alveoli gets filled with water, solid or liquid, any kind of a thing, so this situation is called as the consolidation of lung. And when the patient, when the doctors auscultate it, so there is pleural rub. So pleural rub, it is kind of a rasping sound. When the patient's chest is auscultated with a stethoscope, it is found that the pleural rub may be present when the pleura have been involved. So students and viewers, I'll not take up much in this video. This was the basic definition of the lung abscess, and in this only we have discussed about the clinical features. In the next video from this, I'll be discussing about the investigations and the treatment what is associated to lung abscess. Students and viewers, if you like this video, give this video a thumbs up, and if you have any queries or comments, you're most welcome to comment me in the comment section. New viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.